1027, 1035, WICY as we dive inside the community. My name is John Kazar, joined with a member of Alice Hyde Medical Center, as his name is Dr. Dragos Banu, and that is quite the name, Dragos.
Yes, it is. Thank you.
Yeah, no, I love it. I just wanted to talk about, your different roles at Alice Hyde and how long you've been there for.
Thank you for introducing me and for the opportunity, John. I've been with the Alice family for about 6 years. I'm from Montreal. I grew up in Montreal, and my family and I sort of made our roots in the North Country in Malone right after my training. I started doing primary care and taking care of our nursing home, doing some inpatient medicine as well. Over the last 6 years, my role has evolved with the network and University of Vermont here. I am the site physician leader, and I'm also the medical director from our primary care group here in Malone.
Wow. Okay, so that's a great outline. As we're going to have you talk about a specific topic today that I think is relevant for a lot of people right now, telehealth. Tell us what that's all about.
Yeah, thank you for this. So telehealth comprises really multiple entities. When we think about telehealth, it's sort of our day-to-day. If it's a phone conversation with a patient, if it's a video conversation, or all of the above. Because of the situation that we're in and trying to protect our community, despite the pandemic, Alice Hyde has rolled a telehealth program, and we've really been working on this for quite some time with the network. And it just so happened that we had some infrastructure ready, and since it was difficult to see patients face to face in our offices like we have been used to, we started venturing with this technology. It has been I don't want to say on the market, but multiple clinicians, physicians, APPs have been utilizing this technique all over the world and around the country. And now it sort of just took off very quickly, and we're really in full force here at Alice, telling our patients that we're there for them, even if it's through the video, through FaceTime, through technologies like Zoom, or via the phone. I think I've seen it, at least in my practice, and my colleagues are telling me the same, at least over the last 2-3 weeks, that we have rolled it out. Patients like it. They feel that they can still see their provider, their physician, their nurse practitioner, as they wish and as they need. We have the bandwidth. We have a lot of providers that are ready to take care of our community, so it's as easy as just dialing in, and you still have the connection with your clinician, because if you're fortunate enough and you have internet in the community, you could still see them. If not, you could still hear them over the phone. We are working towards some techniques for people who don't have internet, and more to come on that here on campus, that they could possibly come in and have some form of modality. There is an iPad or a smartphone be lent to them. But for the time being, at least my patients like it. They feel, they can get in contact with me as they need to. We can take care of their medical problems. That is something acute, that is something chronic, or both, via the video. And as one of my colleagues said, if I feel that, things are not looking good over the phone, because I can hear you're speaking fast, I can hear you're short of breath, I can sort of rely on some of my training, even if it is by phone, or if I'm lucky enough to see you through the video visit, I could see a body part that you're complaining, or I could see something that is not right to me. And if you need to seek further care, if you need to get admitted in the hospital, if you need to go to the emergency room, well, I can make that call with you over the phone, and then I can involve a second or a third person that may be able to help. So in a nutshell, that's telehealth.
But it's like there's a lot to it, but we're just going step by step at a time because it's a new concept for a lot of people. And to get comfortable with it, Dragos, is something that it's going to take a little bit of time with. You can't force them right away.
Absolutely. And I think the message that we're trying to give to our community, to our friends, our family, and I mean, we're a small net community here that everybody knows each other. The message is, during this pandemic and difficult times, you can still rely on us. And to your point, if we'll start with a phone call and then hopefully evolve with a video visit, then be it. If it's if we're there yet faster, and if you feel comfortable, and if you have the infrastructure at home, and if you do have an iPhone or any type of smartphone and the internet, then we're here for you. We're here. We have the bandwidth. Our providers are embracing technology because it's new for some of them as well. You have older providers as well in this community that have been providing excellent care over the last years, and they're getting used to this technology as well, and they're doing very well. I can tell you that. The other thing I wanted to tell you is that a lot of times during this pandemic, it's not only about COVID-19. We still have folks with uncontrolled diabetes, folks with cardiac disease, folks with infections of the skin, with abscesses. And for those type of visits, once you reach your provider and you tell them what you need, they may actually choose to bring you in the clinic for a non-COVID related issue. And that's going to be between you and your provider. And the initial step will be a phone call or a video call.
Okay, beautiful. Well, again, Dragos, we're going to let you go, but there's so much information on telehealth. I mean, we could talk about it all day if we wanted to. It's crazy.
Absolutely.
Yeah, and so, if people, want to get involved or learn more about telehealth, where can they go? Who can they call?
The best thing is going to be your provider, your physician, your nurse practitioner, your PA. Talk to them about that. The hospital has some excellent resources that is online and that can be reached via Facebook or our website. But your main person at this point in time is your provider. Get a hold of them, which shouldn't be hard, just the usual way you were doing it up until now. And then we'll get the ball rolling, get you either on FaceTime or on Zoom, on the phone, and hopefully we'll be able to treat you despite this pandemic going on.
Okay. Well, thank you so much for your time. It is Dr. Dragos Banu, who is with the Alice Hyde physician leader for the UVM Health Network Physician Organization. Dragos, cool name, great information on telehealth for us today. We thank you so much for your time.
John, the pleasure was all mine. I thank you and have a great day.
All right. Take care, my friend.
You too.
It's 1027, 1035 WICY, diving inside the community with those from Alice Hyde Medical Center.